I'm Dr. Marengo from Planned Parenthood. I'd like to talk to you about the importance of Pap tests in the detection of cervical cancer. Physicians often use the term Pap smear and Pap test interchangeably. They're the same thing. A Pap smear is a test of the cells on the surface of the cervix. In order to do a Pap, a speculum, like this one, needs to be used to visualize the cervix, which is located at the top of the vagina. However, it is important to understand that a Pap test is not performed every time a clinician places a speculum into the vagina for an examination. Cervical cancer can be diagnosed when there are no symptoms or physical abnormalities at all, and it is much more treatable in its early stages. This is why it is really important to come in for routine wellness exams and Paps when indicated. The Pap test is sent to the lab and the results are reviewed by a clinician. If a person has precancerous cells, the results are graded from mild to severe. Often, if the cellular changes are mild, the cervix can heal itself and a follow-up Pap can be done to reevaluate. If any abnormality is detected, we follow up with the patient. Sometimes this will be a follow-up Pap test in 12 months, or it might be colposcopy, which is a close look at the cervix through a microscope, with potential biopsies of the tissue. For severe cellular changes, we might do an in-office LEAP or excisional procedure, which removes the abnormal tissue from the cervix and promotes the healing process. We recommend that people begin their Pap tests at the age of 21, regardless of the age of onset of sexual intercourse. If your Pap results are normal, you should have a new Pap test every 3 years. After the age of 30, if your Paps are negative, we extend them out to every 5 years if a co-test for HPV is also negative. Women need to be armed with self-advocacy. It's important not to be afraid to ask questions about your exams, your Pap tests, and how often you should be screened. We also strongly encourage the HPV vaccine, which can reduce your lifetime risk of getting cervical cancer by 40 to 95%, depending on how old you are when you get your first immunization. We're here to help you understand your own healthcare needs and which preventive screenings you need over the course of your life.